Welcome back to Healthcare Consumerism Radio. This is for our final segment, and we would like to introduce to you a good friend of ours and one of the leading companies out there in the industry. Cecily Hall from MedEncentive is joining us. Good morning, Cecily.
Good morning.
Hey, Cecily, it's Ron Bachman here. How you doing? One of my favorite people's on the line here. I'm glad to talk to you.
It's an honor to be joining you all, and thanks for having me on. This is a wonderful forum, so thanks for hosting this.
Well, I'll give you a little bit of an introduction, and you can add to it that for our listeners, Cecily is Executive Vice President of MedEncentive. Before that, she was Director of Employee Benefits at Microsoft, where I got to know Cecily a few years ago. I won't say how many years ago to begin the age of Cecily, but a while ago. And there she was managing 65 benefit plans, serving over 140,000 employees and their family members. So you've been involved in this healthcare game for quite some time, knowing the ins and outs from the employer side, and now as one of the solution providers. So tell us what excites you about MedEncentive and what you're doing over there.
Well, MedEncentive, what's exciting, Ron, is that this is something I think that's transformational and so different. And certainly we know from Albert Einstein that insanity is defined by doing the same thing over and over again and expecting a different outcome. And I think when I was a benefits buyer and for the many years that I served in that role, I was frustrated because I wanted something different and something positive and something that would allow for best outcomes, but again, not in a punitive manner and a punitive solution. I wanted something that was positive for my members, but also the physician community at large, and obviously hoping for some savings out of that. And what I found with MedEncentive is that we're achieving exactly that, and it's really about ensuring that the patient has an opportunity to learn about their own health and healthcare, and that the physician has an efficient way to teach. And what we've found and what's being supported now in lots of studies and many articles is that those two components can lead to best outcomes and lower costs, which in turn obviously benefits the payer.
Mm-hmm. We did an introductory segment on the forum that's coming up, and one of the things that I mentioned I think going to fit right into what MedEncentive is doing, and that is we talked about healthcare consumerism in the past has been focusing on the consumer and telling them the consumer what they need to do. They need to change their behaviors. They need to change their lifestyle, and everybody develops products and services that focus on the consumer or the patient. And I think the current phase or development of consumerism as it evolves in this marketplace, and one of the things that we're going to be talking about at the forum is how the shift really needs to go from the patient to the patient-provider relationship. That's the real key, strengthening that relationship, giving it some equal weight of knowledge. Obviously, the patient's not going to be as knowledgeable about medical conditions as their doctor-provider, but they need to be more informed, and the doctor needs to understand the patient a little bit more and how to educate them. Tell us how MedEncentive, because I really see you guys as really almost unique in trying to focus on that relationship and how it works. Tell us a little bit about that.
Right. Well, I couldn't agree more. I think we've failed historically in favor of what we know best, which is evidence-based medicine. Mm-hmm. And instead we fall into platitudes like giving patients things like more skin in the game,
right,
without really allowing them the benefit of information to make good choices. And not only information statistically, but information about their own health and health care. And really, who better to teach them that than their physician? Mm-hmm. And so at MedEncentive, we really do acknowledge exactly what you just described, Ron, and we see that relationship as incredibly special, the relationship between the doctor and the patient. And yet, you know, what we know, and really what a battery of tests show, is that has become more and more difficult. That relationship has been more and more difficult to maintain and bolster because in clinic, physicians have been now relegated to 7 or 8 minutes with that patient. And so truly, I think healthcare's most important medical instrument is good communication. Mm-hmm. But as I said, a lot of studies show that doctors interrupt their patients within their first 23 seconds in clinic. That's a problem, but they're rushing. And that 15% of patients, actually only 15%, fully understand what their doctor shared with them while in clinic. And that other studies show 50% of patients are actually complying with their doctor's orders. And so that causes, of course, misdiagnoses, inferior clinical outcomes. It also lends to other things that are systemic and core to the issues we're experiencing in the U.S. healthcare system, such as higher malpractice. And so we're about health literacy, and it's an empowerment, and it's motivating, and the patient, when they learn about their own health and health care, then drive a much stronger communication cycle with their physician while they are in clinic. And patients want their doctor to know they're getting smart about their own health and health care. And so there's powerful psychology at play as well. So we're excited about that very thing. And we know that even from some recent articles that patient activation is what we're calling it, because you can be knowledgeable, but if you don't take action as a patient and really follow on what you're learning, you won't improve your health. So patient activation is a term you'll hear in the marketplace more and more. And what recent studies have shown is when your activation and health literacy score is higher, then you consume less health care because you are smarter about what's needed and what's not necessary.
So in your core service, tell our audience, what is the responsibility of both the provider, the physician, and the patient in the service that you're talking about?
Well, what we see is those three stakeholders as the three key stakeholders: payer, provider, and payer. And so the responsibility of the patient is to learn about their own health and health care. And we facilitate that through a web-based platform. And the facilitation is really, it stems from an encounter in clinic between a physician and a patient. And so the experience is for a provider, after they see a patient in clinic, they go to the website, our website. They are asked a couple questions about whether or not they're following clinical practice guidelines, because we think that's important for patients to know. And then they prescribe what we call information therapy. You'll see this term used more and more. It's big I, little x, just like RX. And so the physician will prescribe information via articles for their patient to read about their own health and health care. And we reward, we think incentives are important, so we reward the doctor for doing that. They don't have to be big incentives, we've found, but for that process, which takes the doctor about a minute to prescribe information for their patient to read, they're rewarded $15 each time. And then the patient experience is that they're notified their doctor has provided them some information to read about their own health and health care. So they go to the website, they read the article or articles about their health. They're asked to take an open book test on that information because we know that facilitates learning. And then from there, they're asked questions as to whether or not they're following that guidance. And if not, why? Because we think it's so important for there to be information loops between the doctor and the patient. And so if they're not following the guidance, they report out why. And then they agree to let their doctor see their results, the fact that they've completed their information therapy and that they've completed their test and responded to the questions. And then the last thing we ask is for them to rate their doctor on how well the doctor's doing teaching them. And for that, we also provide, through our platform, a small incentive for the patient. So it could be $15, $20, $25, depending on the payer's plan design. And what's fascinating is that every time this has been implemented thus far, there is savings in the form of a return on investment. As well, the lowest we've seen is a 3-to-1 ROI. The most significant we've seen thus far is 17 to 1.
Very good.
So
now, there's a big buzzword out there too, Cecily, the triple aim. Tell us a little bit about that.
Well, as I'm out talking with folks, I hear questions about this, and it's become, you're right, a new buzzword. Certainly, we're hearing it out of the Beltway. We're hearing it out of leaders in D.C. And the Institute for Health Improvement has coined it as a framework. But essentially, the triple aim is better health care, and lower costs. And so if you use that as a framework, and I think we should, then we will solve a lot of the issues in the U.S. healthcare system. And at MedEncentive, we're happy because we think that our solution has been about those three core elements all along. But it's nice to have, I guess, a framework defined and a buzz phrase now being used to describe exactly that.
Now, Cecily, we got about 30 seconds left on the program today. I wanted to thank you for joining us. Give us a couple takeaways for the audience and let them know how they can find you.
Well, we think certainly that we can make healthcare affordable. And to that end, the triple aim can be achieved. But it takes accountability and improved doctor-patient relationships and health literacy, and we think intelligent incentives and some science. And we're thrilled. We'll be in Atlanta at the upcoming Institute of Healthcare Consumerism, and we're thrilled that we'll be a part of the effort there in May. So thanks for having me on, and thanks for, again, hosting these valuable discussions.
All right. And your website, where everyone can find you?
We're at www.medencentive.com. It's MEDENCENTIVE.com.
Right. Thank you so much, Cecily. Thank you to everyone for listening today. And until next Friday,